Okay, moving to a little bit more about dentistry. I
Sure.
understand that you specialize on restorative dentistries, and
Mhm.
we will be talking a little bit about that. But you also love and you've been promoted of enhancement magnification using loupes or microscope. So let's talk about a little bit of that, how the magnification can improve your practice, but also how if there is some evidence backing all this up.
Whew, that's a lot to unpack there. I was first introduced to restorative microscopes actually at Tufts. So at Tufts,
Okay.
they brought someone in and they trained the four of us to use a microscope just for restorative. We had a little bit with endodontics in dental school, but very, very minor. So um, when I was at Tufts, I realized, the more you can see, the better you can do.
Mm.
But it's not practical to take your microscope from office to office. So it wasn't until I had purchased a practice that I really started to think again, okay, how do we do this? We were encouraged to buy loupes. Our very first week at Dugoni, I think we were measured for loupes after we'd been there maybe 5 days. So there really wasn't even an opportunity to not use magnification ever. So I've always had some sort of magnification. Um, but when I moved to private practice and made a purchase there, it was always on my list of like things to buy was a restorative microscope. And I was lucky enough to go ahead and acquire one a couple years in. And I didn't use it all the time, but when you start to look at your own work and maybe why it's not going so well, if you can
Mm.
see something at X, maybe then the light bulb goes off. I was like, oh, how can I do that better? Or how can I prevent that from happening next time? And so it's very sobering, very difficult to look at your own work and feel like judged by yourself. But I honestly think that's how we get better. That's how I
Mm.
felt I've gotten better is by being really critical,
Self-evaluation.
self-evaluation. Absolutely.